A heart attack is a serious medical emergency that happens when one of the blood vessels in your heart gets blocked and prevents blood from reaching your heart muscle. Without blood, your heart muscle begins to die and can cause permanent damage or even death. Heart attacks are very common. In fact, every 40 seconds, somebody in the United States has a heart attack. That's about 800,000 heart attacks each year. And they don't all follow that same sudden, chest-clutching, drop-to-the-floor formula you see on TV. Some heart attacks are gradual and subtle. They may start with mild symptoms that are easy to ignore or confuse with other conditions. But ignoring these early warning signs can be a fatal mistake, because the sooner you get treatment, the better your chances of survival and recovery. So in this video, we will reveal the 8 early warning signs of a heart attack that you should never ignore. So, without further ado, let's get started. Number 1. Pressure or tightness in your chest. This is the most common symptom of a heart attack, but it may not feel like pain. It can feel like uncomfortable pressure, squeezing, fullness, or heaviness in your chest that lasts more than a few minutes or comes and goes. It may also spread to your arm, jaw, neck, or back. This happens because the blockage in your coronary artery reduces the blood flow to your heart muscle, which causes ischemia, which means lack of oxygen, and chest pain, also known as angina. Number 2. Pain in your arm, jaw, neck, or back. Sometimes the pain from a heart attack can radiate to other parts of your upper body, especially on the left side. You may feel pain or discomfort in one or both arms, the back, neck, or jaw. This happens because the nerves that supply these areas are connected to the same spinal cord segments as the nerves that supply your heart. When your heart is in distress, it sends signals to these nerves, which can cause referred pain, which is pain felt in a different location than the source. Number 3. Cold sweats. Breaking out in a cold sweat is another sign that something is wrong with your heart. You may feel clammy, cold, and sweaty, even if you are not doing any physical activity or feeling hot. This happens because your body is trying to cool down and cope with the stress of a heart attack. Your nervous system activates your sweat glands and dilates your blood vessels near the skin surface to release heat and lower your body temperature. Number 4. Heartburn or indigestion. Sometimes a heart attack can mimic the symptoms of a digestive problem, such as heartburn or indigestion. You may feel a burning sensation in your chest or stomach, or have trouble swallowing or burping. These symptoms can be triggered by certain foods or medications, but they can also be a sign of a heart attack, as the blockage in your coronary artery can also affect the blood flow to your stomach and esophagus, which can cause inflammation and irritation of these organs. Before we continue, if you have been finding this video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Shortness of breath. If you have trouble breathing for no apparent reason, it could be a sign that your heart is not getting enough oxygen. You may feel short of breath when you are resting or doing normal activities, or you may gasp for air or wheeze. You may also feel dizzy or lightheaded. This symptom happens because the reduced blood flow to your heart affects its ability to pump blood to your lungs and other organs, which can cause respiratory distress and low blood pressure. Number 6. Nausea or vomiting. Feeling sick to your stomach or throwing up can also be a symptom of a heart attack. You may lose your appetite or feel nauseous. Now, you may be wondering, why does your digestive system have to do with your heart? Well, when there is a heart attack, your digestive system is affected by the reduced blood flow to your heart. Your nervous system also releases hormones and chemicals that can stimulate your vomiting center in the brain and cause nausea and vomiting. Number 7. Unusual fatigue. Feeling unusually tired or weak can be another warning sign of a heart attack. You may feel exhausted even after doing simple tasks that normally don't tire you out, such as walking or climbing stairs. You may also have trouble sleeping or wake up feeling groggy. This happens because the reduced blood flow to your heart affects its ability to produce energy and meet the demands of your body. Number 8. Dizziness. The drop in blood pressure caused by a heart attack can make you feel dizzy or faint. You may lose your balance or have trouble standing up. You may also feel confused or disoriented. This happens because the reduced blood flow to your heart affects its ability to regulate your blood pressure and maintain adequate blood flow to your brain and other vital organs. If you experience any of these warning signs of a heart attack, don't wait to get help. Seek medical attention as soon as possible. Every minute counts when it comes to saving your heart and your life. Remember, not everyone has the same symptoms of a heart attack, and some people may have no symptoms at all. The symptoms may also vary depending on your gender, age, and health conditions. Still, the best way to prevent a heart attack is to know your risk factors and take steps to lower them. Some of the risk factors for a heart attack include: number 1, age. The risk increases as you get older. Number 2, high cholesterol levels. Cholesterol is a fatty substance that can build up in your arteries and cause blockages. Number 3, diabetes. Diabetes affects how your body uses sugar and can damage your blood vessels. Number 4, genetics. Having a family history of heart disease increases your risk. Number 5, heart surgery. Having had previous heart surgery can make your heart more vulnerable to damage. Number 6, high blood pressure. High blood pressure puts extra strain on your heart and arteries. Number 7, obesity. Being overweight or obese can increase your cholesterol, blood pressure, and diabetes risk. Number 8, smoking. Smoking damages your blood vessels and reduces the oxygen in your blood. Number 9, stress. Stress can raise your blood pressure and heart rate and trigger inflammation in your body. Number 10, alcohol. Drinking too much alcohol can raise your blood pressure and cholesterol levels and damage your heart muscle. Now you know the risk factors, but how can you lower your risk of a heart attack? Well, here are some ways you can prevent a heart attack. Number 1, quitting smoking. Smoking is one of the worst things you can do for your heart. Quitting can lower your risk of a heart attack by 50% within a year. Number 2, staying active. Getting regular exercise can strengthen your heart and improve your blood circulation. Aim for at least 150 minutes of moderate intensity physical activity per week. Number 3, eating a balanced and healthy diet. Eating more fruits, vegetables, whole grains, lean proteins, and healthy fats can lower your cholesterol and blood pressure and prevent diabetes. Number 4, getting enough sleep. Sleeping well can help you lower your stress levels and regulate your blood pressure and sugar levels. So, aim for at least 7 hours of good quality sleep per night. Number 5, keeping diabetes under control. If you have diabetes, follow your doctor's advice on how to manage your blood sugar levels and take your medications as prescribed. Number 6, limiting alcohol intake. Drinking too much alcohol can harm your heart in many ways. So, limit yourself to no more than 1 drink per day for women and 2 drinks per day for men. Number 7, checking your cholesterol and blood pressure regularly. High cholesterol and blood pressure are often silent killers that don't cause any symptoms until it's too late. Get them checked regularly and follow your doctor's advice on how to lower them if they are too high. Number 8, taking medications as prescribed. If you have been prescribed medications for your heart condition or risk factors, take them as directed by your doctor. Don't stop or change them without consulting your doctor first. At the end, remember, a heart attack is a serious medical emergency that requires immediate attention. Don't ignore the warning signs and don't delay seeking help. Your heart and your life depend on it. Now, we want to hear from you. Did you or someone you know have some of these signs before? Was it actually a heart attack? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.